It's really important that we have a vision and some objectives and priorities so that we know what we're here for and that we put our resources and our time and energy into the things that will really make the difference for our patients. So our overarching vision is to provide outstanding care for every patient. And when we talk about every patient, we talk not just about the patients that we see today, but the ones that are going to come tomorrow and next year and in 10 years' time. So for me, that encapsulates all of our strategic objectives. It's around ensuring our staff are empowered, ensuring we're living within our money, and that we're innovating for the future and thinking about what's going to be needed for the patients who will need us in the years to come.
One of the reasons why I'm so proud to be chairman of this organisation is the fact that every single person I meet in every walk of life in the hospitals is entirely focused on delivering outstanding care for patients. And of course, that is one of our key priorities for the year. We want to continue to focus on that and do it even better.
I think it's good for all members of staff to have a focus. They obviously have their day jobs. I think to have a vision statement of where we actually see ourselves to, I think is actually vital to give us that sort of firm foundation.
I'm really proud that at our last CQC inspection we were awarded outstanding for the care that we provide to our patients and outstanding for the care we provide to our patients at end of life. And of course our new objectives are linked to our values, and what we want to do this year is to make sure that our care is outstanding for every patient.
Outstanding care for our patients is our number one priority because we're a hospital and care for patients is what we do. When we talk about outstanding care, I mean both the quality of care that we deliver, its safety, its effectiveness of the care, and the experience of people having it, but also that it needs to be timely care, that there isn't too much waiting, whether it's an emergency or whether it's people who are waiting for elective care. So quality and timeliness is all part of outstanding care, and that's our number one priority.
So as Chief Operating Officer, what's really important to me are the priorities around delivering outstanding care for our patients, and there are three key areas in there that I think are really important. Firstly, it's delivering timely cancer care for our patients who are suffering from cancer. Secondly, it's around delivering our operations and planned services to patients waiting to come in for planned care within 18 weeks. And finally, it's about meeting the standards around delivering timely care in our emergency departments so that patients are seen and treated within 4 hours.
I think for me, one of the really important objectives is training the 80 quality improvement practitioners who can look at the stumbling blocks, especially nurses, to see how we can improve the care we're delivering.
I'm excited that over the next year we're developing clear career paths and training opportunities for all of our staff. We're going to be focusing on our respect value, and we're going to be supporting managers in new ways to develop their teams and create a positive culture of empowerment.
So we have 6,000 amazing staff who work with us, and they're going to be the people that are going to help us deliver the new objectives in the years going forward. How we're going to do that is by continuing to support and respecting our staff. And one of our objectives, which is really important, is how we empower our staff.
As part of empowering staff, it's important to give them freedom to speak up. And as one of the Freedom to Speak Guardians, which is a role supported by the executive, we would empower patients and staff to speak up about any concerns they have, because we would want to address those concerns and learn from them.
I'm really excited about the links between these objectives. For example, improving our recruitment and retention will allow us to reduce our reliance on agency staff. That makes cost saving, but it also means that teams can grow up and really support the healthcare that we deliver to our patients.
The operating theatres are a big resource for the hospital, and it's important that we utilise that resource as efficiently as possible, and to improve our efficiency in theatres would enable us to do more operations to achieve our waiting list times and treat more patients.
By hitting our financial targets, we generate enough cash to be able to invest for the future. Our digitisation programme is very, very exciting and will make huge differences to our staff and our patients, but it will also allow us to have a rational replacement plan for our medical equipment.
These priorities are really important to me as a member of the transformation team, as part of our role is empowering staff to identify areas for innovation in order to provide outstanding care for our patients whilst living within our money.
The digitalization program is important, not only for me but for the trust, because it is good for the clinical staff, likewise non-clinical staff, because it is easily accessible.
I think that by having one vision, the whole trust is moving together in the same direction.
These are exactly the strong, clear objectives that we should be aiming for. Empowering our staff working within high-performing teams to deliver outstanding healthcare to our patients all the time, every time, within the resources made available to us.
So I see these objectives as promises that we're making to our staff and to our communities about the things we're going to do in the year ahead for the benefit of our patients and to help us provide outstanding care every time.